guess I wasn't expecting the big gaps in different areas of health here. That was the first thing. So particularly oncology, orthopedics, pediatric surgery, ophthalmology, and women's health, and particularly obstetrics. These areas, there's huge gaps. Gaps in skills. There's not enough doctors, like highly skilled doctors, and a lot of the pathology that presents really late. So the doctors are seeing really advanced stages of disease. So the gaps in certain healthcare is an issue. And I think the other issue is that public health itself is still very new. There's not a lot of understanding from the community here in terms of basic health prevention, in terms of the dangers of smoking, in terms of not putting 5 spoons of sugar in your tea, in terms of eating way too much and getting obese, in terms of not exercising, all these basic things that we're bombarded with in the Western countries since birth, that are really only just starting here. And also what's missing here is a primary healthcare network. In UAE, the system is based off the American system, which we know there's not a lot of primary healthcare in the US. It's very much a self-referring to a specialist. And this was a system that was adopted here. And as we know, it's a very expensive system. It's not very efficient, not very good outcomes relatively to the countries that have a strong primary health system. So this is something that's also being developed, but it was quite a surprise to me to see just how little primary health care there was here. And the idea of primary health care really has been that here is doctors in primary health, all they do is write referrals off to a specialist, and they don't have skills for anything else. So, and this is something that's changing. And the insurers here are certainly pushing to get more of a gatekeeper model to try and contain the costs.